Cats are highly tolerant animals, often masking discomfort to avoid appearing weak. This instinct stems from their survival mechanism. Illness in the wild signals vulnerability, making them potential targets for predators. As responsible pet owners, it's crucial to stay vigilant and recognize subtle signs of illness. If your cat shows any of these 10 symptoms, it may be time to consult a vet. 1. Lethargy. If your cat suddenly becomes less active, avoids interaction, or stays hidden in a corner for long periods, it may be unwell. Cats that ignore their favorite toys or don't respond to their name could be dealing with illness or pain. Try gently engaging them with a toy wand. If they remain withdrawn, it's a sign that something isn't right. 2. Abnormal eating patterns, loss or increase in appetite. Changes in appetite are another red flag. If your cat eats less than usual, it could be due to stress, dental problems, or gastrointestinal diseases. Alternatively, increased hunger, especially with weight loss, might indicate hypothyroidism, often seen in older cats. Be mindful of excessive thirst, which could signal diabetes, especially if accompanied by frequent urination. 3. Abnormal grooming and coat condition. A healthy cat spends significant time grooming. If your cat stops grooming or over-grooms certain areas, it might be experiencing skin irritation, pain, or stress. Check for tangled fur, scabs, redness, or signs of fleas and mites. Skin conditions like ringworm can also affect grooming behavior, leaving noticeable patches of hair loss. 4. Respiratory issues. Sneezing, nasal discharge, and watery eyes might indicate respiratory infections or allergies. While occasional sneezing is normal, frequent sneezing with discharge could signal a cold or upper respiratory infection. If your cat is coughing, it may have airway irritation, bronchitis, or more serious conditions like heartworm or pneumonia. Record any unusual breathing patterns for your vet. 5. Eye, mouth, and nose abnormalities. Monitor your cat's eyes for redness, swelling, or excessive tearing. These could indicate eye infections or cataracts. In the mouth, bad breath, drooling, or swollen gums may suggest dental disease. Additionally, check the nose. It should be cool and moist, except right after a nap. If it's dry or cracked for long periods, it could indicate dehydration or illness. 6. Vomiting. While occasional vomiting can happen, frequent or severe vomiting is a cause for concern. If your cat vomits immediately after eating, it may have overeaten or consumed stale food. Brownish or bloody vomit could indicate ulcers or internal tumors, which require urgent medical attention. Bring a sample of the vomit to the vet for a more accurate diagnosis. 7. Abnormal movements or activity levels. Sudden changes in movement or activity can also indicate health problems. If your usually energetic cat becomes lethargic, or if it avoids climbing stairs and jumping to familiar spots, it could be experiencing pain. Pay attention to any limping or stiffness. These may be signs of injury or arthritis, especially in older cats. 8. Behavioral changes. If your cat suddenly becomes aggressive or fearful, it might be experiencing discomfort. Sudden changes in behavior, like hiding more or becoming clingy, can indicate stress or illness. 9. Increased scratching or head shaking. Persistent scratching or head shaking might indicate ear infections, allergies, or parasites. Examine the ears for redness, swelling, or foul odors. 10. Weight changes. Sudden weight gain or loss is a serious concern. Weight loss can indicate chronic conditions like kidney disease or cancer, while weight gain may be a symptom of metabolic disorders. By staying aware of these signs, you can act early and ensure your cat receives the care they need. If you spot any of these symptoms, schedule a visit with your vet for a thorough examination.